those people who rely on it. Our constituents deserve nothing less from him.
Kate Osmore.
Thank you, Madam Deputy Speaker, for calling me so early in the debate. I was not expecting that. I very much welcome the investment in our NHS and our renewed focus on our public services. This budget marks a break from the approach of the previous government, which presided over the decline of our health system. With this renewed investment, the biggest since 2010, there is now some hope that we can turn this dire situation around. Because we must improve patient outcomes, reduce waiting times, support the hard-working staff who form the backbone of our health system. However, I would like to stress to the Secretary of State, my neighbour, investment must focus not only just on delivering numbers, but on quality of care, with a human touch and equal access for all. That requires us to reject the creeping privatisation of our health service, which has proven costly, inefficient and bad for patients. Madam Deputy Speaker, before coming to this House, I worked in the NHS. I worked as a practice manager in the London Borough of Enfield. Also, I worked in an out-of-hours GP cooperative which covered North and East London. So I know firsthand that GP surgeries and core NHS services must remain publicly owned and accountable to its patients, staff, the public and stakeholders. Furthermore, I do have deep reservations with the current plans to grant the NHS data platform contract to Palantir, which raises some serious questions about privacy, security and the future of our NHS data infrastructure.
Thank you very much. I thank the Honourable Lady for giving way, and I was listening very carefully to what she was saying about her experience as a practice manager. Does she share my concern that over this past weekend and the last 2 days I have had numerous contact from local practices in my constituency concerned about the impact of the national insurance changes and what they will do to their ability to provide patient care, and that vital first step in getting people into the hospital, getting through the waiting lists. Does she agree with me that we have to address that as a fundamental problem created potentially by this budget?
I thank the honourable member for her intervention, and what I would add to what you have said is it's important that patients, the doctors and everyone is listened to, and I am assured the Secretary of State will be listening to all voices. Thank you. NHS data is a public asset and its management should be rooted firmly within the NHS and not placed in the hands of private interest, especially one controlled by an individual so hostile to the principles of public healthcare. Our NHS thrives due to the work of everyone in the system, from nurses to administrative staff to healthcare assistants, who each play a critical role in patient care. We must listen to all NHS staff, with everyone bringing valuable frontline perspective on improving efficiency, patient experience and accessibility, and not just those in the highest ranking medical roles. I would especially like to draw attention to the hard-working staff who provide out-of-hours services for our communities, often doing this on top of their normal hours that they work. The government must ensure that these professionals receive not only recognition, but also the resources and support they need to continue serving our communities in this vital way. Staff in out-of-hours services often only work in these settings part-time. However, they are often the last resort for people unable to get appointments with their GP or access the care they need. We must also address the postcode lottery in healthcare. Disparities persist in access to specialists, waiting times and outcomes along grounds of area, ethnicity and gender for various conditions. It is a stark reality that mental health services remain woefully inadequate. We are facing a medical health crisis, especially amongst young people, impacting personal well-being and ruining life chances. We urgently need targeted investment in mental health services, And I look forward to supporting the government in ensuring that the crisis in mental health support is treated with the seriousness it demands. This budget is a strong step in the right direction, but we must go further in ensuring that the NHS remains public, that mental health is prioritised, and that all NHS staff have a voice in shaping the future of our health system. In closing, Madam Deputy Speaker, I ask the Secretary of State to focus in all of these areas, because I believe with us being consistent and the investment throughout this whole Parliament, we